I actually found a breast lump. That's how it all started. And I went to get it checked. And it turned out to be nothing. He went and he did the ultrasound, and there was a small tumor on this side and 3 cysts on this side.
So thyroid cancer in her age range, is fairly, I would say, it's not unusual to see. We typically see patients above the age of 20 to in their 60s, 70s with thyroid nodules and thyroid cancers. Can you be cured of this? And the answer is yes, and she is cured of this at this point. First line is surgery, and arguably the most important one is surgery, is to actually remove the cancer from the body by total thyroidectomy, which is what she had.
I was worried about the scar. I spoke to Dr. Farra about the scar, and she made sure to tell me that it would be very, kind of like a plastic surgery, and you wouldn't be able to see it, and it'll fade with time. And I'm happy with my scar.
This is kind of a nuisance you have to deal with. Surgery and whatever treatments, and 6 months down the line, a year down the line, it's like you forget about it. And most of my patients, that's what it's like, and I think that's going to be the same for her. If patients that have concern for thyroid cancer or any thyroid issue, I really emphasize seeing someone who really, this is what they do. They live and breathe that. I'm an endocrine surgeon. This is 100% of my practice is thyroid, parathyroid, and adrenal surgery. I did special training for that. And I do think, that makes a difference. There's a lot of data today that shows that high volume physicians in whatever specialty have the best outcomes.
So my experience here in Sylvester was amazing. It's very different than any other hospital that you go to.